everybody hear me quite clearly? Do I need to speak up? Is it quite clear there at the back? Because I can't hear whether speakers are loud enough there at the back. So, really, a warm welcome to all of you today, to my side of the presentation or the side of the day. A really massive thank you to Leanne. So I know that Leanne is really passionate about infertility, and that most of you, I don't know whether you know her journey, but she'll most probably share her journey towards the end of today. So thank you so much for the opportunity, Leanne, for inviting us to sponsor your event today. So majority of my presentation will focus on polycystic ovarian symptoms today. So just a little bit more about myself. My name is Adele Bale. I'm working for Innova Pharmaceuticals, and we are the distributors of a health supplement called Sinopol, which is indicated for polycystic ovarian syndrome. So just to give you a little bit more background on what Sinopol actually does and where it fits into polycystic ovarian syndrome, it's very important for all of you to first have a better understanding of what polycystic ovarian syndrome actually is, and how it affects a lot of people around, and what does it look like when we are looking in clinical practice. So polycystic ovarian syndrome is a health condition that affects around 10 million women around the world. So it is actually quite common, but amongst women who don't know anything about polycystic ovarian syndrome, there's about 80% of patients that's being diagnosed with PCOS. We call it PCOS, which is just a little bit shorter for polycystic ovarian syndrome. 80% of women that is being diagnosed with PCOS actually do not know that they've had PCOS. So it is a situation or a condition that is quite common, but many women don't actually know what it is all about. And that's also the most common hormonal disorder amongst women with reproductive health that is battling to fall pregnant. So what does it affect? What does it involve? It involves hormonal imbalances as well as metabolic imbalances. When I'm talking about metabolic imbalances, I'm talking about conditions like insulin resistance, hypertension, where you've got high blood pressure, also dyslipidemia, and these are big words which majority of you might not know what it's all about. That's basically high cholesterol. And these are conditions that when we are going on later in our life that we might face a risk of. Also infertility, type 2 diabetes, as well as cardiovascular disease, ovarian cancer, and quality of life. In many instances where people are increasing a bit of weight as well. So when we are moving on to where and what and how do we see polycystic ovarian syndrome? So PCOS presents in different forms, in different stages of a woman's life. So when you're born, you're highly likely being born with polycystic ovarian syndrome. But when you are moving along in your life and you are reaching your adolescence years, then you are starting to battle with acne, starting to put up weight, and you actually don't know what is going on, and you just think it's hormones. Yes, it is hormones. It's an imbalance in your hormones that is causing that. And when we are moving on to your reproductive, when you are trying to fall pregnant, then a lot of people normally are on contraceptives. They go off contraceptives, and then they don't menstruate, and they cannot understand, why do I don't menstruate? It's because there's an imbalance of hormones, and that is causing you to not ovulate. And because you're not ovulating, you are not menstruating. And then when the same person moves on into their metabolic years, they are starting to struggle or become a risk for your type 2 diabetes, your dyslipidemia, and your cardiovascular risk patients, and also risk for ovarian cancer. So it's not to say that you have to have all the symptoms that is available or that you see with polycystic ovarian syndrome in one stage of your life. When you've got polycystic ovarian syndrome and you've been diagnosed, it basically follows you throughout your life, and it presents with different symptoms in different stages of your life. When we're trying to understand how does all of this work and how do these many symptoms fit into categories or groups, I really try to put it and group it into 4 different groups to make it a little bit easier to understand and to see whether you fit in one of those groups or maybe in more than 1 or 2 or 3 of these groups that you can identify yourself where you actually fit in. So the first of these ones would be, so how do PCOS look like? So PCOS can be when there's hormonal imbalances. Actually, look at, I just want to get to the slide in front of me as well. So 90 to 90%, 95% of women who do not ovulate have polycystic ovarian syndrome. So many times it might look like a big thing and it might look very tragic to you in your life, but it's just a matter of balancing your hormones. You will start ovulating, you will start menstruating, and you will be able to fall pregnant. So what do these manifestations look like when your hormones are imbalanced and you do not ovulate? It's exactly what I say. You most probably miss a lot of cycles that you do not menstruate. You might menstruate but not regular, or your cycles might be very shorter. The times in between your cycles might be very shorter or very longer, or when you're menstruating, might be menstruating just for 1 or 2 days and not a full cycle. So it's basically everything around irregular cycles when you're getting to polycystic ovarian syndrome, and that relates to infertility, and that's why you're likely to fall pregnant. Then when we move on to the next section is insulin resistance. So insulin resistance is a big contributor to polycystic ovarian syndrome, and as I go along through these 4 different sections, these different areas will influence the other one. So it becomes a vicious cycle where the one manifestation is affecting the other one. At the end of the day, it just becomes so difficult to manage all of these imbalances. So we see that between 50 and 80% of women that have PCOS have insulin resistance. So it's quite a big contributor to PCOS. And what does this look like? This is present in slightly overweight patients, but it can also be present in patients that has a normal weight. But sometimes when you've got insulin resistance, you can see it, there's dark crease in your neck area, under your arms. And that is basically called the big word, which is called acanthosis nigricans, that is available to identify insulin resistance. And all of this, like I said, contributes to hormonal imbalance and to hyperandrogenism. And that brings us to hyperandrogenism, quite a big word. And what does this mean? First of all, 60 to 80% of women with PCOS suffer from hyperandrogenism. And what does this look like from a clinical perspective when you look at yourself? That is when you have unwanted hair growth that is growing in a male-like pattern in areas where you normally do not have hair growth, or just abnormal. And this would be on your toes, on your chest, facial hair, and I'm not talking about the Greek lady that's got a bit of a moustache because she's got dark hair. This is really when you are growing. It's like men's hair. It's like hard and they're thick hairs. It's not just like normal thin hair like some of us do have. You also get some hairs growth around the nipple area. So when you have these irregular hair growths, you will most probably know, because you need to spend quite a lot of time having these hairs waxed, and it becomes really a quality of life issue in your life. Then acne. Acne is a big thing with clinical manifestation with hyperandrogenism, as well as hair loss, where you start seeing bald patches in your hair growth, like in a male pattern. We don't normally see baldness amongst women as what we normally see, which is quite common amongst men. So when you start seeing that, when your hair is starting to fall out in certain patches, then you know then the risk of having hyperandrogenism is also quite high. And basically what it is, it's an increase, or when you have too many male hormones in your body. Then the last is called oxidative stress. And as we are breathing, as we are living, there's free radicals forming in our body. So all of us do have them. When you have too many of these free radicals, it's causing oxidative stress. It's causing inflammation in your body, and your egg cells just don't like inflammation and a lot of free radicals at all. And that becomes quite a big problem, that it can also increase the risk of damaging your egg cells. So, and then lastly, this also promotes insulin resistance as well as contributes to hyperandrogenism and infertility. So as I said, all four of these different areas are interlinking with one another. So the one is actually making the other one worse, and the other one is affecting the other one's causing one of the other ones. So they are working hand in hand together with one another. And at the end of the day is, how do we actually help all of you to try and balance all of these hormones to basically make sure that all of these areas are going back to normal balances in your life. So talking a little bit about Sinopol is, how can we as a health supplement make a difference in all of your lives if you're being diagnosed with polycystic ovarian syndrome, or if you've not been diagnosed, you think you might have it. So Sinopol is a health supplement that helps to correct your hormonal imbalances connected to or linked to polycystic ovarian syndrome. And why is Sinopol different? So there are various health supplements currently on the market that is helping to assist with symptoms with polycystic ovarian syndrome. What are the three things that Sinopol can basically bring to you and offer you? We have a unique formulation. We're the only ones with the correct concentrations of myo-inositol as well as alpha-lipoic acid and folic acid in the combination. And the trick really comes in when you are starting to add, when you're adding your alpha-lipoic acid to your myo-inositol, and that is really when the magic happens in that specific concentrations. We also see that it's a fast-slow technology, and I will talk a little bit more on one of the other slides on the fast-slow technology, because this is quite important and you might not be aware of it. And then lastly, it's scientifically researched. It's one of the few, or I can almost say, I think it's the only one that is indicated for polycystic ovarian syndrome, with a vast amount of clinical papers and clinical research and trials being done specifically on the product Sinopol in all four of those areas that I showed you: the hormonal imbalance, your insulin resistance, your hyperandrogenism, as well as your oxidative stress. So you will remember those four different areas that I've showed you. If we look at those four different areas to see where Sinopol actually contributes and makes a difference. From an insulin resistance perspective, these are some of the studies that we've seen and the results that we've seen in insulin resistance, where 43% was a 43%, almost 44% reduction in insulin resistance. There was a 35% reduction in insulin resistance in your adolescent patients. And when we move to your metabolic patients or your postmenopausal women, we've seen that there was a 66.7% reduction in insulin resistance. These are quite high numbers. Moving on to hyperandrogenism, remember these are your acne, your bald pattern when you're starting to lose bald patterns, if you're starting to lose hair, as well as your facial hair or your unwanted hair growth that you are experiencing. With a 40% reduction in serum testosterone. Remember I said the hyperandrogenism is caused by an increase of male hormones. So you would like to get the male hormones as low as possible, or lower to the level where it's actually normal. 26.4% reduction in androgens, which is your male hormones, and a 16.4% reduction in hirsutism at the end of the day, which is your unwanted hair growth. Then moving on to the other two areas, your oxidative stress and your hormonal imbalance. I'll be focusing on more hormonal imbalance first. Did I press the wrong button? Okay, from a hormonal imbalance perspective, there was a 44% increase in pregnancies when Sinopol was used in combination with your IVF. So you're paying a lot of money for IVF. Many of you might not be able to do this more than once if the first one is not successful. You might as well just add a health supplement that's got clinical proof that it actually increased or almost doubled your chance to fall pregnant if you're doing IVF. We also saw a significant improvement in menstrual cycles from 2 to 5 cycles in a 6-month period. So instead of having 2 cycles, it increased it to 5 cycles, which is very close to having normal menstrual cycles in a 6-month period. And then we also saw a 14% reduction in ovarian volume, and the size of your ovaries is one of the clinical factors that your gynecologist or infertility specialist will be able to diagnose you with polycystic ovarian syndrome. Then looking at oxidative stress, so what we see is that alpha-lipoic acid that's in a combination of Sinopol is one of the most potent antioxidants that you currently get on the market. It also regenerates your vitamin, your other antioxidants that you have in your life or in your body. So really, really a potent antioxidative stress product you can take. I said I'm taking Sinopol myself just because if I'm not going to age, I would like to take Sinopol. So from an oxidative stress perspective. Great. Then moving on to the fast slow release. So the alpha-lipoic acid that is in the combination of Sinopol is not just a normal alpha-lipoic acid. It's actually quite novel technology that's been included, that it is a slow release. So when you're just taking normal alpha-lipoic acid that is not in a slow release format, you will most probably get about 30 to 40 minutes active working in your body, because the half-life is between 3 and 4 hours. What we've done with the alpha-lipoic acid that we added in the Sinopol combination, which is patented as well, is we've made sure that you're getting 24-hour coverage if you're taking 2 sachets per day. So 1 sachet will cover you for 12 hours. That's quite important to have your alpha-lipoic acid be working 24 hours per day in your body. And that's quite important in Sinopol, in the way you're taking it, to make sure that you are taking it in the correct way. So this just shows you, I just want to see, where is this? So that is when you're using an alpha-lipoic acid which is not in a slow release format, and this is when you're using an alpha-lipoic acid which is in a slow format. So you're basically getting full 24 hours if you're taking it twice a day. On the right-hand side, all of this information will be available as well at the back of our stand. You will also each receive a Sinopol bag. So when you're breaking for lunch or before you leave, please make sure that you have taken a bag from us. All of this information on how to take Sinopol is also included in the bags. So it is a sachet, and you need to take it twice a day, preferably an hour before you are having your meals, because you already want Sinopol in your bloodstream when you are starting to put insulin in your body or food in your body. Then, very, very important, you will see that after you started to stir it for around 10 seconds, you will notice that the consistency of Sinopol becomes a little bit thicker. This is normal, and the reason for this is to disperse all the yellow granules that is in the sachet or in the powder. What those yellow granules are, those are the slow release granules. So even if you have to lick out the glass, make sure that you are getting all those granules in. But the consistency that thickens just makes sure or helps that you are actually taking all those yellow granules. So you don't have to put in warm water or lukewarm water and try and get those granules to dissolve. They will not dissolve. So you can just put it in normal cold water, normal water, just a little bit, and you make sure that you are taking those granules with the fluid as well. So that is basically everything that I've covered on that slide, and that is it from me. So if you need more information on polycystic ovarian syndrome, also please feel free to go visit our website, which is just www.sinopol.co.za. More than welcome to go read more information. You're also welcome to come speak to us at the back of the stand if you need more information about polycystic ovarian syndrome or about the product itself, about Sinopol and how it contributes in helping to rebalance your hormones.